Let me ask you a question. How many times a week do you exercise? I mean, really exercise. Heart rate up, sweating, getting all of that blood flowing through your body. How many days? Truth? How many days? Not just last week or the week before, but in general, how many days do you exercise a week? It is so important because you know what I say? Exercise is the best medication. I'm gonna tell you more about it. I'm Dr. Suzanne Steinbaum, and today we are gonna talk about exercise. Make sure you subscribe below, but let me tell you about exercise. It is by far the best medication. So the more you do it, the better it is. And I gotta tell you, although I am sitting on this bike right now, stationary here, biking outside is not exactly my thing, especially in New York. I am more concerned of near death, being hit on my bike, than I am about the exercise. So that's not something I'm gonna do. And then, you know, you hear some people getting up every morning and going for these 6 a.m. runs. That's also not me. I am very lucky to get up, get dressed, get my son fed and to school and me to work. So morning exercise is not my thing. But you know what? I started dancing when I was a little girl. I think at 3 years old, I took my first ballet class. And I have been dancing my whole life. I have found an awesome dance routine, exercise, Anna Kaiser technique that I get to do when I go home at night right on Zoom. And I love it. I think about it. I can't wait to do it. So that's what I want you to find. Something you love, something you cannot wait to do, that you put in your schedule, that you get to move that way. You get to do that thing that makes you healthy and makes you feel good. So find your thing. Is it dancing? Is it riding a bike? Is it getting up at 6 a.m. and going for that run? What is it? Doesn't matter what it is. You just gotta find something. Here's another thing about it. All day long, as much as we're sitting all day long in front of the computer, in our chairs, commuting, whatever it is, our butts are sitting. We're sitting. We gotta just make movement part of our lives. That when you're actually having a meeting, maybe you do it on a bike. Maybe you get up and stand. Maybe you just go for a walk. You have to just keep moving. Somebody said, I'm not sure who, but is sitting the new smoking? Think about it. Remember the days when smoking was the thing that was going to cause you to die? I think it's time we think of sitting the same way. The more you sit, the worse it is. Believe it or not, it changes your cholesterol, your inability to process sugars. You get fat, you get unhealthy. It increases your risk of heart disease. You gotta get up and you gotta move and you gotta make it a part of your life. Let's figure out how to check your heart rate. Take your index finger, follow it up to your wrist, put your fingers right there. That's your pulse. You can check your pulse for 10 seconds, multiply it times 6, and that's your heartbeat per minute. As you exercise, your heart rate goes up, and that tells us how much work you're doing. You know, exercise is not just about making you look good or feel good. It's about getting you heart healthy. So let's make sure we're doing enough exercise. How you do it? You measure your heart rate. I'm gonna tell you, this little watch of mine, this little Apple Watch, it became my best friend when I found out that I can actually see if I am exercising to the maximum that I want to do. There's a lot of different kinds of watches out there and monitors that you can use. And sometimes I tell people it's kind of the easiest way to figure it out. But if you can't, you can do it on your own as well. So your heart rate and where you get it to matters. I'm gonna give you an equation. Get a paper and pen. Ready? 220 minus your age. Take that number and multiply it by 85%. That's where you want to get your heart rate to exercise for cardiovascular benefit. Now, if you're just starting, don't multiply by 85%, multiply by 65%. Start there and gradually work your way up until you get your heart rate to goal. How you do that? 30 minutes, 5 days a week. Start really slow. But if you start exercising for 30 minutes, 5 days a week, you will find it improve. That heart rate becomes higher and higher the fitter and fitter you get. Good luck. Let me know how it goes. You know what the best thing is about every single day? Every day you get a new opportunity to make a new and better choice. So what are you gonna do? What are you gonna do tomorrow to be healthy? I want you to think about this and I want you to commit to it. Pick one thing tomorrow, starting now, that you are gonna do for yourself that is going to make you feel healthier. What is it gonna be? Tell me, go to my Instagram and tell me what you're going to do. I know what I'm gonna do. I decided that tomorrow I'm gonna make sure that I start drinking more water. I'm in a mask all day seeing patients, and I sometimes forget to take my mask off in my office and take a quick sip of water before I go out. It's gonna matter, and it's gonna matter for my health. Sometimes it's really hard to put yourself first, and sometimes it's really hard to be reminded that you have to put yourself first. So keep that in mind. Figure it out. What are you gonna do?